So next we're going to go over general shoulder pain. This is going to cover anything from an impingement to a muscle strain to even bursitis in the shoulder. We're going to go over some stretches, some strengthening, and how you can progress doing things that will help rehab that shoulder. First, we're going to start with just some active stretching of that shoulder. So Emily's going to act like her left arm is the shoulder that's bothering her. She's just going to take a towel and she's going to do what's called a towel slide to the front or shoulder flexion. She's going to take that towel up, lean in to get a good shoulder stretch. She would hold that for 8 to 10 seconds, doing about 10 of those. After about 10 of those, she's going to turn sideways. She is going to do the same thing going up sideways, leaning in. If this is too much, she can go back to a 45-degree angle and come in that way in what's called the scaption plane and just slowly progress back to that full sideways. Same thing, she's going to do 8 to 10 of these, holding for about 10 seconds. She'll do a couple of those. Next, you can use a dowel rod, a cane, a broomstick, anything that you have at home just to do a couple more stretches with. So next she's going to use that right arm to take the left arm up as high as she can, just letting that left arm go along for the ride. The right arm's the one doing all the work. She's just going to hold that for, again, 8 to 10 seconds, doing about 10 of those, just to get a good stretch in that arm. Next, we're going to work on being able to reach behind the back. So she's just going to take that stick behind her back and she's going to pull it up like she's pulling her pants up. Same thing, holding that for 8 to 10 seconds to get a good stretch. This is going to help get those hands back behind the back again. Next, we're going to talk about some initial strengthening of that shoulder. She's going to be using some bands that we have here, but at home you can get a band similar to this or to this at a drugstore, Walmart, somewhere like that. They're fairly inexpensive, and they do have different strengths per color. Usually the darker the color, the stronger the resistance is. But the first thing she's going to work on is just some shoulder extension. So she's just pulling that arm straight back, working on some of the muscles back behind that shoulder. She would do 2 to 3 sets of 10 of these, just nice and slow and controlled. She's not going to go really fast. She wants to get a good contraction of those muscles back behind her back. Next, she's going to do a row, squeezing those shoulder blades back together. Again, strengthening the back portion of those shoulder blades just to get a good posture on those shoulders. Again, she would do 2 to 3 sets of 10 with these. Next, she's going to work on what's called an external rotation. So she's going to stand with her left arm coming across her body, and she's going to keep that elbow tucked in right at her side, and she's just going to rotate that arm in and out, almost like she's pivoting from the shoulder and the elbow. Same as before, she would do 2 to 3 sets of 10 of these, progressing with more as she gets stronger. The next one's going to be an internal rotation. Just the opposite move as before. Instead of pulling out, she's pulling in. Same thing, she's pivoting from that elbow and the shoulder. 2 to 3 sets of 10 with those. If you don't have a setup like this at home, you can take a band like this, tie a knot in the end of it, close it in a door jamb, or even tie it in a circle and put it on a doorknob. And you can do everything just single armed, or you can loop it into and do both arms together. Next, we'll go into some progressions of laying down, strengthening that shoulder. A lot of times when it comes to shoulder pain, we are all weak in the shoulder blade just because everything we do is in front of us and we get a little bit of that rounded shoulder. So what she's going to work on is all the muscles that attach to her shoulder blade and try to get a little bit better posture in that shoulder blade. So the first thing she's going to work on is this lower trap muscle here, and she's going to do an eye exercise. So she's just lifting that arm up, thumb towards the ceiling, and she's really thinking about taking this shoulder blade back and down to the opposite hip as she lifts that arm up. She'll hold for just a brief second at the top and do 2 to 3 sets of 10 of those. Next, she's going to go in a Y motion. So she's going to come up at a 45-degree angle and do that same thing. Again, she's thinking about taking that shoulder blade back and down to the opposite hip. Same, she'll do 2 to 3 sets of 10 of that one also. The next one, she is coming straight out to the side in a T motion, and she's thinking about pulling the shoulder blade into the spine, working on those, that middle portion of the trap. She'll do 2 to 3 sets of 10 of those. Next, she's going to do just a normal row. She can add weight to any of these exercises at home. You can use a soup can. If you don't have dumbbells, a soup can's a nice lightweight to start with any type of shoulder pain. Next, she's going to do a horizontal row. So she's keeping the elbow bent as she comes up, and she's just bringing that arm out to the side. All of these exercises are going to be 2 to 3 sets of 10, starting with 2 sets, and then as you get stronger, you can bump up to the 3 sets. If you're coming to us for therapy, some of the things that we can help with here are, I'm actually going to get Emily to roll over, and we can do things like passive range of motion here. We can also do some soft tissue massage. Anything that is tight on the shoulder, we can go through and work on. We usually get the patient to relax, and we can do any type of massage, from working on the front portion of the shoulder, the bicep, the upper trap, and even coming back around the back side of that shoulder blade. And we can mobilize that shoulder to where if you do have an impingement and that shoulder is pulling up into the socket and pinching some of those muscles and tendons off, we can actually work on that shoulder and try to get that joint capsule loosened up and increase that range of motion. So that's some of the ways that you can work on the shoulder at home by yourself, and some of the things that we can help with here in the clinic.